Welcome to the Fed to Fed podcast, where we dive into the dynamic world of government technology. In this podcast series, we'll be joined by current and former federal leaders and industry trailblazers who are at the forefront of innovation. Here, we speak openly and honestly about the challenges and opportunities facing the federal government and the Department of Defense and its partners in the modern age, driving innovation and the incredible capabilities of technology along the way. Whether you're a federal leader, a tech industry professional, or simply fascinated by IT modernization, just like us, this podcast is for you. And we're so happy to have you tuning in. Louis Miles is passionate about helping federal agencies and departments leverage information technology to solve critical business challenges to better enable mission realization. Louis has over 30 years of industry experience in business development and program management. He is currently a program director at MicroHealth, LLC, a market-leading service-disabled, veteran-owned SBA 8A small business that specializes in IT-related solutions in the federal health space. Louis, welcome. Louis, thank you so much for joining us today.
Oh, thanks very much. It's a pleasure to be here, and thanks for having us.
Fantastic. Well, why don't we just dive right into some of the questions that I have been dying to ask you? And let's start out with, what are some of the emerging data analytics opportunities and trends in the federal space that your team is experiencing in this new marketplace?
Yeah, I think that there's just really a lot going on, particularly in the federal healthcare arena, that's really creating a wealth of opportunities, in support of the trends. And I think I would be remiss if I didn't, mention everyone is really looking at how to leverage AI and to leverage AI in the context of what we do from a data analytical perspective is something that provides some unique opportunities to be able to further interrogate the data, to provide deeper insights, to better enable decision makers to, in our case, leverage this information and these key insights to make better decisions that support their mission. In addition to the onslaught of AI in the trend within our marketplace, I think that also in the federal healthcare space, many of the federal agencies, the trend that you see is one that's driven by modernization. I think in the last few years leading up to where we're at today, this has been an overlooked market, whether it's within HHS or the Veterans Administration or on the DoD side, that's really pushing towards infrastructure modernization. And within the modernization, removing some of the silos that have really prevented agencies from being able to access and share information in support of their desires to really democratize data and really get it down to the point where users can get access to that information and incorporate it into how they get their jobs done. So, along with modernization and the introduction of AI, I think that one of the other trends that we're seeing a lot of is security. Because of the PII and the nature and security that has to be around the sensitive data that's within the federal healthcare space, there's increased focus on, data security. And with that, section access is something that we see a lot and do a lot, not just in terms of securing the data such that those on the outside who don't have access can't get access, but within the agency itself, ensuring that individuals, whether it's at a national level or a department level or at an area level, that the right people have the right access to the data that they are authorized to have access to. And then the final thing is, integration, interoperability of sharing this data. The data comes in many formats, whether it's HL7 or something else, and then being able to ingest that data, normalize that data, and then make that data available for analysis, are just some of the trends that we're seeing in our market space.
That's great. Thank you so much for sharing that information. So, how is microhealth used in understanding of those trends and opportunities in your work with the Indian Health Service?
Yeah, from a micro health point of view, we're really focused on helping our customer realize their mission objectives. And the core mission of the Indian Health Service is really focused around improving health outcomes, improving the quality of life for its constituents that it serves. And to that end, the things that microhealth is doing in the analytics space is really providing support at multiple ends of the spectrum. One is, if I start with the legacy environment that exists that we inherited on this contract, is looking at ways in which we can continue to operationalize a fairly antiquated legacy environment so that it remains functional and operational, and that there is the ongoing access to the data. And at the same time, while we were flying that plane, is to do some operations, to do strategic upgrades, whether it's on the operating systems, whether it's improving how we access data coming from a variety of different data sources, and from a variety of different systems. Because at the Indian Health Service, they believe in autonomy, and they don't force the tribes to standardize on any given platform. So where there is the initiative to deploy a new EHR system, it's optional. Many have come on board, but others choose to supply data to the agency using their tools of choice. And so one of the things that MicroHealth is doing is ensuring that whatever platform, whatever format that data is made available to the hub, we have the ability to access that data and to make that data available for analysis. And so, in addition to how we're able to gather that information coming from a variety of different sources and systems, is then be able to partner with our constituents, with the end users, if you will, that we can help mature their thinking and their understanding about how to use data analytics to improve their agency, their department's ability to respond to the mission. And we do this in a number of different ways, in support of an agile methodology, in terms of getting minimally viable products out as quickly as possible so that solutions can be in the hands of our users sooner than later, and then continuing to build and expand on the products that we deliver and being able to customize them for the end user and making them easy to access, easy to use, and with that, giving them confidence in the quality of the data. That the data that we're providing is complete and it's accurate, and it is something that they can readily use to impact the lives of those that they serve. So those are just some of the ways in which microhealth is responding to the trends and applying its resource capability in support of our customers' mission.
That's great. Thank you so much for sharing that. So, what's your top tip for government agencies and their industry partners as they consider these opportunities? How should they prepare for the future success for their programs?
I think that the preparation really begins with a steady flow of information and education and awareness. Because in the federal healthcare arena, there is just an onslaught of information and tools that are available to improve performance, to strengthen the outputs of data, and in terms of how that data is ingested and using. So I think that one of the things that we try to focus on is trying to create a center of excellence around data analytics. And I think that ties into just the awareness part. From a micro health standpoint, we do a monthly user group. That user group meeting that we hold is technical in nature, so that those individuals that are looking to understand some of the emerging technologies and support that along with the trends in which end users want to be able to view and analyze data. We use that forum to share information and knowledge so that our end users can benefit from the things that we're learning and applying as we build out the dashboards and the reports that we're providing. And so, in addition to just the awareness, is to ensure the integrity of the data. There has been a heavy emphasis of late on data governance. And then within data governance, HHS has a agency-wide initiative that's focused on improving data governance through metadata management. And so again, education and awareness and data governance provides that mechanism that can normalize how data is ingested. It can set the quality standards and with that, the expectations. It can identify the key data sources in which agencies can and should be extracting information and sharing them amongst themselves so they're in a better position to analyze and benefit from the trends that they are seeing. And I think the last thing that I'll mention, and that is just because of the onslaught of opportunities that are available to an underfunded set of agencies within federal healthcare, is the need also to be very strategic in how they think creatively about modernizing their environments. So, with that, it's very important to not only get the right people on the bus, but make certain that you have the right resources and the right seats that can support architecting your to-be environment. You are applying project management best practices to ensure that there is visibility into the scope of the project, as well as the timeliness of the deliverables of those projects. And they are all in alignment with your mission, your objectives, and the agency's overall strategic plans. So I think if agencies would look at education and constantly building their maturity around how to leverage analytics while they're modernizing their environment and using best practices from a project management standpoint, then they can maximize those investments and ensure on-time delivery to support mission realization.
That's fantastic, Louis. Thank you so much for sharing all of this important information and the great work that you all are delivering across the federal health IT space.
Thanks for having me.
This concludes today's episode of the Fed to Fed podcast. If you enjoyed this episode, please don't forget to subscribe, rate, and leave a review. Your feedback helps us continue bringing you thought-provoking conversations with the brightest minds in government technology. Stay tuned for our next episode, where we will continue to explore opportunities to harness the power of technology and explore what's next in developing a more innovative and efficient government. Until then, this is the Fed to Fed podcast by GovTech Connects. Thank you for joining us.